All right, here's another great way to mobilize that thoracic spine we were just talking about. Having the patient in this seated position with their elbows supported on the table, and then same kind of thing. In this position, I can actually give a little bit of a motion there to feel any spots that might be tight or restricted. And let's say right about there, I'm just going to give a little bit of pressure there. And what I'm going to have the patient do is try to pull your elbows down to the table there. Good, so actually try to pull like you're pulling, yeah, there you go, perfect, just like that. Is that okay? Mm-hmm. Good, and relax. And then I can also kind of come just a little bit out to the side. This is where your ribs attach onto your vertebrae over here. So I can actually bring my hand, instead of right in midline like this, I can bring it off to the side a little bit. And I'm just going to assess the mobility of those ribs, which can limit your rotation and your side bending as well in your golf swing. So I can actually have him bend a little bit to the side, just like that, while I'm assessing there. That's a good spot right there. And let's say we try to pull those ribs down, or I'm sorry, your elbows down. There you go. And relax. Great. And then pull down again. And relax. Good. And then once we mobilize in that seated position, just like supported, we can have you come up. Let's say we have a seat right here. So this is another progression of what we were just doing in that seated supported position. This is full weight bearing for the patient. So this way I can control the patient's rotation, I can control their side bending and also their extension and flexion, and localize in that three-dimensional plane exactly where they're restricted. So let's come back to that rib area where he wasn't moving as well. So let's rotate towards that left side, side bend, extend a little bit, and right there. Good, and then just try to pull your elbows down into my arm there. That's great right there. Good, and relax. And then we increase that range. You doing all right?
Yep.
Good, and then try to pull down again. Excellent, and relax. Very good. All right, so there's just some few examples of both hip and thoracic spine ways that we can mobilize you with functional manual therapy. We can do this to any joint in the body, but these are some really good ones to work on specifically for the golfer. So give us a call, sign up for that golf performance package. Looking forward to seeing you.